Disturbing. That's what Cincinnati Mayor John Cranley calls some of the findings of our I-Team's investigation.
Tonight, he shares why he called for an investigation into how a local nonprofit spends your tax dollars. I-Team reporter Hillary Lake is here to explain what he sees as a potential problem. Hillary.
One of the mayor's biggest concerns is if the Center for Closing the Health Gap is using tax dollars to fund a political agenda.
I'm Mayor John Cranley, and I believe that every citizen deserves the best chance to be healthy.
The mayor doesn't dispute there's a racial disparity when it comes to quality access for health care in Cincinnati. That's why he supported the mission of a local nonprofit.
The Center for Closing the Health Gap is working hard to improve the well-being of our entire community.
But the I-Team discovered the city refused to pay some of the invoices for the health gap last month because the city determined those expenses to be outside the scope of the group's work. A letter from the city to the group says the invoices billed the city for Black Agenda work. The city refused to pay for it because the Black Agenda is a local political group.
We have to be vigilant to make sure that city tax dollars are not being used for political purposes.
After 7 years of funding from the city, that was the first time that we had experienced anything like that.
The Health Gap's CEO, former Cincinnati Mayor Dwight Tillery, is also a board member of the Black Agenda. Renee Mahaffey Harris is the Health Gap's executive director.
We are one of many organizations that are part of the Black Agenda.
The I-Team discovered the Health Gap also submitted an invoice to the city for websites for the Black Agenda. The city did pay for those, even though Harris insisted it's not using taxpayers' money for political purposes.
We are not using any funds from the city to pay for the Black Agenda activity.
Can you explain how that happened?
Well, listen, your reporting has brought to light some very disturbing facts about the way the city money has been spent.
Cranley tells the I-Team the city's investigation into the health gap will focus on spending millions of dollars of taxpayer money.
Obviously, the contract is for reducing health disparities. It's not for political agenda issues. So clearly that's, if that's true, that's clearly wrong, and it needs to be reimbursed to the taxpayers.
Cranley wonders if the $1 million the health gap wants for next year should go elsewhere.
We have a duty, in my opinion, to measure how they're doing, and if they're not measuring up to, say, our health department, we should give the money to the health department. Vice versa, if they're doing better than our health department, we should give them more money.
The mayor has vowed for a quick turn on the investigation. He also tells me he thinks the city should review how it tracks the performance of nonprofits that receive city grants. For the next city budget, a new ordinance will require city council to review grant applications in a more in-depth way before they approve the grants. Back to you.
Hillary, great job. Thank you.